and marketing funding, which I think does have a fairly dispositive effect on the health of these exchanges. Thank you, Mr. Chairman.
Thank you, Senator Murphy. Senator Burr.
I've listened intently to this discussion, and I'm reminded as we talk about how to bring health care costs down that each state is unique. But health care cost reduction is a function of a change in outcomes. Change outcomes, you change the cost of health care. So let's not lose focus on what the most important thing is. But Ms. Miller, I've got to admit that I was moved by a statement you made that everybody should be able to buy into FEHBP that can't fit in a box. You know, I came from the private sector, and my experience in government is my health care went up and my benefit went down. Then the ACA came, and I'm now a participant in the DC exchange, and my premium and costs went up, my deductible went up, and my benefits went down. I would love to buy into FEHBP as a member of Congress again, wholeheartedly. I'm not sure that's the answer, though, for a population that's scattered, most of it rural, most of it without the delivery system that's needed to change the health outcome. So this is not just about coverage. This is about placing them in some type of delivery system. So I'm going to start at this end. I'm going to go up to Mr. Doak. All I want to know, yes or no, are you supportive of your state having control over how your health care plan looks in your state? In other words, you got a 1332 waiver or 1215 waiver. You can decide exactly how it's going to look. We'll figure out the financing. Yes or no, Ms. McPeak?
Absolutely. I think Tennessee can better manage our health outcomes for our consumers.
Mr. Creedler?
I'd very much like to see the answer would be yes, but let's make sure we protect consumers and not take away their protections.
You would have full control over that, so you'd be the one to be held responsible, Ms. Wingholler?
One state size does not fit all, and Alaska needs to be in control of its health insurance program for its residents.
Ms. Miller?
As long as we're not talking about reduced federal funding and requiring states to come up with that funding, which Pennsylvania couldn't do, then yes, I think we are in a great position to regulate our markets.
All right. So we've got agreement that one of the things we should look at is to empower states to design their health care, to structure their health care system to meet the unique delivery system capabilities within their states. I think we've made tremendous progress. He already answered that they were supportive of it. That's what I played off of. Ms. McPeak, in order to solve the health care crisis facing our country today, we need to think of ways to leverage all of the new tools provided through innovation in health care. Insurers have access to tremendous amounts of data on the individuals enrolled in their plans in a way that wasn't imaginable just a decade ago. With this new information, health care insurers have the opportunity to design plans that incentivize the best possible health outcomes for their customers. As an insurance commissioner, have you had an opportunity to review plan designs for your state?
Well, no, unfortunately, in the individual market, the carriers are limited by the ACA to the plan design and underwriting factors in the law. So the data.
Believe that should be also a function of the commissioner in the state?
Absolutely, I do.
Is that, in your estimation, a way to leverage health care data to offer more health insurance?
I do, and actual benefits that are accessible and usable by our consumers.
Do you believe you have the tools you need to review innovative plan designs working to keep pace with the new capabilities of health care data?
I believe we do, because we review those plans and rates for the employer markets and small group markets already today.
I'm reminded that we're headed for a decade of disruption, where technology is going to impact every sector of our economy, probably healthcare as big, if not bigger, than anywhere else. And some of the challenges we're trying to build into our construction of policy today will be trumped, for the lack of a better word, by our capabilities of connecting an individual in a rural or non-covered area where there's not a hospital, not a doctor, but because every American has this device, that there's going to be software that enables them to send their own vitals that are needed to a lab that will give them a reading without a hospital, without a doctor, without a nurse. How do we take advantage of this incredible innovation if, in fact, we've constructed in concrete what insurers can and can't do. Mr. Doak?
Yes, sir. Great question, and very, that you are absolutely right. With the mobile phone devices, the innovation is definitely taking on. One of the things that we just held an innovation summit in Tulsa with in partnership with Oklahoma State University and the University of New Mexico. They presented on a Project Echo, which actually has dramatically helped and assisted rural outcomes across the country. And I think when you take a look at this program, it's in my report. And see what they're doing, the partnerships that they're doing, able to drive great health care through programs to rural America is really, the innovation is happening at such a quick level that you're absolutely right. I think that's why the NAIC and the leadership under President Ted Nickel from Wisconsin formed the Innovation Committee, that we really have to stay ahead of the curve. So you're on the right track, sir.
Mr. Chairman, could I ask all of the witnesses to provide in writing for the committee thoughts that they might have on offering multi-year access to plans? In other words, individuals in the individual market, not signing up for 1 year, signing up for 5 years or longer, so that we can truly feel the benefits of the investment by the insurer to get people healthy, to keep them healthy, to eliminate the risk tail that drives up these premiums so drastically. Thank you, Mr. Chairman.
Thank you, Senator Burr. That'd be very helpful if you could do that. Senator Hassan.
Well, thank you, Mr. Chairman and Ranking Member Murray, for